And okay, so I have a tiny puppy in the background who is playing with a food ball, so she might interrupt the stream occasionally. But I've got a few different journal articles to be going over tonight that I'm really excited to review, as they're super important papers, as they're talking about pain in rabbits, and then we're going to chat a little bit about avian handling as well as avian procedural sedation. So this is actually a series of 3 papers that were published in the Veterinary Nursing Journal, so a British journal, or the Journal of the British Veterinary Nursing Association. And these are all by Anissa Malik, who is a veterinary nurse working in the UK with exotics and wildlife. Sorry, I'm also still in my work uniform, as I was back to work in a new clinic today with my team, which is awesome. So, these animals are super cryptic and stoic, because again, when we're looking at exotic animals and how they just basically how their brain is programmed. So many of them are prey animals. So they do something called masking phenomenon, which again, if you are working with exotics, you need to be familiar with masking phenomenon. But effectively, when they're sick or injured, they put all of their effort into looking normal so that they don't look like an easy meal for a predator. As predators definitely, they try to optimize their energy use, right? So unless they're an ambush predator and they're just kind of waiting for something to walk by while they're cryptically hiding, if they're any kind of pursuant predator, or a predator that stalks prey, they want the most energy efficient meal. So if an animal looks sick or looks injured, then they probably don't have great stamina, so they're probably an easy meal. So that's why prey animal species have collectively adapted masking phenomenon, which is their extremely strong instinct to hide signs of illness or hide injury so that they don't look like easy prey. Unfortunately, they maintain this behavior or this instinct when they're captive. So even though rabbits are technically domestic rabbits, they are not really truly that domestic, and they still maintain this very, very strong instinct to hide signs of illness or injury. So many rabbits will have very subtle changes in their behavior or very subtle tells that they're in pain, which is super frustrating, because managing pain is kind of one of the most important things that we do in veterinary medicine. Oh, hang on just a moment. The puppy is trying to eat something. Hi, little miss. Can you stop chewing on that? Hi. Here. What's that? We're going to try to keep puppy distractions to a minimum unless she wants to come on camera. Hey, Bee. Hi, come here. Come here, little miss. Hang on. Hi, you want to come up here and be adorable for a minute? Oh, okay. This is the puppy. This is Beatrice. She is 3 months old. She is a little monster. You guys, I know that you're here for exotic med, but we're going to have a puppy here for a moment. She's definitely in shark mode. She's still in the teething stage where she wants to bite everything. And she wants to drink my tea. Hang on. All right. So, let's scroll on down. So, recognizing that your patients are in pain is the first, obviously, the first point. Here, there you go, puppy. The first point when we're looking at managing pain, because obviously, if hang on, the puppy is being a real terror. Just a moment. All right, sorry about that, guys. Puppy was just about being in kind of sleepy mode, and then kind of went full on shark mode and was trying to destroy things. So my partner has puppy now, because puppy is not manageable for the stream, unfortunately. So sorry, as I was saying, kind of the first step in treating our patients' pain appropriately is ensuring that we understand how they're demonstrating signs of pain. So that can be really cryptic in a lot of these prey animal species. So in this article, she does highlight that we have lots of incorrect or outdated pet rabbit welfare information. And that is a huge problem, even in the veterinary world, where kind of semi-routinely we see second opinion cases where patients are given just inappropriate treatment regimens or inappropriate, really old doses, especially of pain management, that are just ineffective. So that's really depressing and unfortunate, because we hope that, everybody who is seeing these animals is really doing kind of modern medicine, and doing our best to kind of provide accurate care or species appropriate care. So let's Scroll down a little bit. So what's kind of, I guess, like the most important thing that I try to communicate with clients when I'm going over how we want to interpret changes in their pet, whether it's a post-operative pet and we're looking at, like if our pain management is adequate, or it's a pet with a chronic painful condition like pets with osteoarthritis, or pets who have dental disease that we're managing, because they're often on pain management long term, is to get clients to appreciate the subtle signs. So things that are very, very subtle. So like really slight changes in how they posture. So sometimes if rabbits have like a sore hip or a sore back, they might kind of like not just sit in that perfect straight little like bunny sitting position. They might like list to the side a little bit, which is something that we see dogs and cats do. Certainly it can be very challenging to appreciate those changes in dogs and cats. But often these animals will do their best to like hide limps and hide limp favoring. So very subtle changes in their appetite or food preference, or even inability to groom, or just like being less willing to groom themselves. So rabbits that are kind of like grooming, maybe their front arms, but then not really reaching back and grooming kind of their rump or sacral area. So those can be rabbits that are painful. So important that she also notes here that these behaviors will disappear as soon as the rabbit is boxed up to go to a veterinary practice, which is so true. Typically when I'm assessing patients in the room, I'm kind of keeping an eye on them as long as they're in a visible carrier, so that they generally will kind of let that masking phenomenon subside once they've been in the environment for quite a period of time. So if I'm doing like a history, going over husbandry, and the client is saying, oh, well, he does this, X, Y, Z at home, I kind of wait for those behaviors to come back when we're examining these patients or taking a history or triaging them. And that's true for any exotic, especially birds. So they noted that this rabbit sanctuary identified like a very subtle head lifting behavior indicating abdominal pain in one of their rabbits. So this is a rabbit who's probably kind of like doing like a subtle stretch and being like, oh, my belly hurts, but I'm trying to hide it. So that's super interesting. And of course, clients can definitely record behaviors at home to show us. And that's something that's never been easier. Like, gone are the days where we have to, take photos of husbandry setups or cages and then have like the photos developed at the pharmacy or at the photo hut. We now have access to pretty good quality cameras that are on us all the time. So it's often pretty easy to kind of tell owners that, hey, if you, use your phone, just record the video and then bring it in to show us or email it to us or what have you. I find sometimes emailing it to us is not very user friendly, because sometimes file types are just like wildly different depending on the type of phone that they're on. So moving on to our moderate signs of pain, we have the Grimace scale. And if you're not familiar with the Grimace scale in rabbits, this organization, so the National Center for Replacement, Refinement, and Reduction of Animals and Research, who do a lot of important work on kind of maintaining a standard of animal welfare for research animals, which is really important. So they are a nonprofit, and they used to be able to send out these posters for free if you requested them. I think that changed during COVID, where we just have a downloadable version now. But effectively, like Grimace scales, it turns out they work really, really well to assess pain in many species. So we have them here in rabbits. So again, like this is something that you can get printed. Unfortunately, they won't ship you a free copy anymore, but you can definitely print this on like I think this is like a legal size paper. This does not quite fit. It's not quite fit regular size paper. So they're looking at features like orbital tightening. So when rabbits have that kind of like slightly closed eye look, they're around the orbit is really tight. The orbital area is narrowed. They flatten their cheeks so that the face becomes a little bit more angular and has that less rounded appearance. Their nostril shape, so whether they have like a tighter V-shaped bunny nose rather than the nice happy like smiley face, the relaxed U. Their whisker shape as well as their ear shape. And you can definitely, I feel like the ears are probably one of the most obvious ones that we tend to appreciate first in hospital, just because the ears are so prominent in rabbits. So I'll like be sitting across the room taking a peek on a patient and notice that they're doing the ear flattening. It's like, we need to assess you for pain. So they have these available for rabbits as well as rats and mice. So if you're treating any of the species, I highly recommend, printing these or at least having digital copies for review. And I have seen that some hospitals will have like kind of a printout, just like a chart to do grimace scaling and use grimace scaling on their pain assessments on a regular basis as part of their nursing rounds, which is a fantastic idea. It's something I'd really like to implement for post-op cases, as well as in patients where we know they have a painful condition. So grimacing can be pretty important. It's a very reliable sign. We see abdominal pressing, and of course, they tend not to be as perky as usual. And this is where we can start to see GI stasis. So those rabbits that are starting to have kind of like the slightly abbreviated, slightly craggy looking, maybe like a little more dry, a little more small, just slightly abnormal looking poops. So that's kind of like one of our early signs of stasis occurring. And stasis, we know that stasis and pain really go hand in hand. So rabbits who are painful will develop a stasis because of the stress hormones circulating, or inflammatory hormones, like especially prostaglandins. We know that stasis is also inherently painful, so it kind of becomes this snowball effect where if we're not treating the animal's in pain and they have a stasis starting, the stasis makes them more painful, so then it gets worse. So it can be this vicious cycle of pain and discomfort. So that's really something that we have to keep an eye out for. So, and of course, animals might not exhibit these issues or these problems in consult rooms because, again, masking phenomenon, sometimes it's only when you get them in hospital and they've been there for a little while, or they've been in the exam room for a bit, then they start to kind of show that they're not happy. So then more severe signs can include rabbits that are, really inactive, really lethargic, very quiet, not super responsive, or like responsive but dull. If they're doing bruxism or bruxismus, so they're tooth grinding, which sometimes clients tell me that they think that the rabbit is coughing because they don't know what tooth grinding sounds like. And certainly like in really tiny bunnies, as well as like chinchillas and guinea pigs, sometimes it kind of sounds like a little buzzing when they're grinding their teeth because the sound is just so small. But rabbits who are tooth grinding, that's really important to pay attention to. And of course, more severe grimaces. And then, just being like kind of less engaged with the environment. These are rabbits that are trying really, really hard up until this point to appear normal. And now these rabbits just can't look normal anymore. Like the pain is just overwhelming. They've passed that threshold of being able to maintain masking phenomenon. So although there aren't really any very standardized pain scales like we have for dogs and cats, which I think is the Colorado State University that has that. Let me double check. Hang on. Dog pain scale. Yeah, so this one here, this rainbow one that I always think of, so they call it, it is Colorado State. So Colorado State has this dog pain scale. They also have a cat pain scale. So we don't have something that's standardized like that for rabbits, but we do know what the signs of pain are in rabbits, and then how we can correlate that to the animal's severity of pain. So the grimace scale, again, is like a more objective scale, a little subjective. But just because we don't have that kind of perfect chart like we do for dogs and cats, it doesn't mean we can't do pain scaling and we can't do, pain assessments on these animals. So, so she's just kind of going over more research. It's of course important that when clients will often try to minimize the importance of many of these behaviors because, there are so many reasons why clients do this, and we see it in dogs and cats as well, but I find that the struggle is really prominent with exotics just because so many subtle changes in exotics do mean that something is severely wrong. So, just because your rabbit is also, still eating and pooping, but he's, not doing certain behaviors anymore, or a really good example is I had a chinchilla patient once who had stopped rolling in their sand bath. And it was because of heart disease. So because that was aerobic exercise, the chinchilla, stopped using the sand bath or would like kind of go for it and then stop. that was an animal's very subtle tell that something was wrong, and that animal unfortunately had heart disease. So paying attention to those very subtle changes are so important, and I always praise clients for bringing them up and saying, hey, like, I know you just said that you think it's nothing, but in our little exotics, those very small observations can be very significant, so it's great that you notice that, and it's great that you brought it to our attention, especially because, again, when clients have appreciated these changes happening for a long time, they often don't want to think that it's associated with a disease or a pathology. So really important to emphasize that, yeah, if you notice anything subtle, that can mean something in an exotic. And I know it kind of sucks if we have to like do testing and do imaging now because you said that, oh, you know, my animal is just not using the wheel anymore, but it's really important because those are signs of illness, and we try not to ignore our signs of illness in other companion animals like dogs and cats, so why should we do it in exotics just because they're really good at hiding it? So she has a fantastic chart here. Anissa's done a great job here of putting together signs of acute pain in rabbits. So this is a wonderful reference that I'd like to kind of print and have laminated or have handouts to like give to clients about, you know, what you should look out for with your rabbit. And of course our pain score here. So she has, she effectively has like that pain chart, like what the dogs and cats have. So it's not quite as thorough. It's pretty thorough actually, but it is not so bad. So maybe just like a little bit less detailed than the dog and cat one, but definitely something usable. So, oh, and actually they've got a rabbit grimace scale score sheet here. So unfortunately, we definitely see that there's some data kind of redacted here. But this is just kind of like a quick reference. This says it's by NC3RS, but I haven't seen this kind of chart on their website. So maybe I'll email them and find out if they have. Yeah, because I just have the posters here, so I'm not sure. Maybe this used to be available and now it isn't. Yeah, so patient recovering fracture repair, see Appendix 2 in the online. So, okay, so maybe they do have that available in their supplement. So it's something I didn't notice before. So, of course, we should be taking a holistic approach to our patients, and I'm a big fan of kind of like taking back the word holistic. Holistic doesn't necessarily mean that you're using alternative medicine that's not proven. I think it's just kind of taking a full kind of environmental and physical and physiological and behavioral approach to our patients, because it's so important in exotics because we have to rely so much on very subtle information. So whole patient assessment, so important for any of these animals. We're looking at chronic pain assessment because chronic pain can be really challenging. These rabbits can again be having like really subtle changes at home. And then, you know, maybe just having kind of chronic waxing and waning, like mild gut stasis. So, important to like be asking about what is your rabbit doing with their poop habits. So does it ever look different? Do you ever find that when you clean the cage, like is it a little smaller, a little drier, a little more craggly, not so round and perfect looking? Because these waxing and waning stasis patients that the client may say, oh yeah, like I give critical care whenever that happens, like that's really just ignoring signs of pain. And again, it's never because the client, you know, doesn't want to, you know, treat their animal who's in pain. It's often that they just don't understand that can be a sign of pain or other disease. There's really interesting research going on. Dr. Jennifer Graham, who is one of the editors of the big new exotic emergency textbook, she gave a talk with a whole bunch of other specialists at ExoticsCon this past August, because it's still 2022 for another month. Happy December, everybody. Where they think that, you know, even maybe some echiniculi patients where they have chronic echiniculi infection, but then they're not showing those classic signs like the head tilt and nystagmus. Some of these animals may actually be waxing and waning gastric stasis cases because of echiniculi. So really interesting. So composite pain score for rabbits would be a great consideration. So again, if we have a tool that is as thorough as the Colorado State University dog and cat pain scale, wouldn't that be amazing? And we just have to accept that these animals are difficult to assess, and that client education is a really important aspect of making sure that they're appropriately treated for pain. So I'm just going to close this here. So again, this is a 3-part series, which is fantastic. So for vet nurses in hospital, what can we do to manage pain? Because that's, a great thing that we do for our patients is we alleviate pain. So part 1, again, she's just summarizing part 1 here. But managing pain, again, one of the most important things that we do. We have so many options for drugs now. Compared to like 20 years ago when I started in vet med, there is so much data now. It's not like just a ton of guesswork. We actually have pharmacokinetic and pharmacodynamic studies available for lots of drugs and lots of animals. And there are wonderful specialists with lots of interest in making sure that we can have appropriate protocols. So there are many, many different options. She has an example here of a orthopedic surgery, so a hind limb fracture repair from a healthy rabbit. So we're premedicating with the pure mu agonist opioid because, again, ortho stuff is really painful, and midazolam, which is an anxiolytic and a mild sedative. Midazolam is probably one of my favorite drugs to use in exotics. We use so much of it because it tends to be very, very well tolerated at reasonably effective doses, and it just helps with anxiety because we have to assume that prey animals, even if they're, again, like domestic rabbits, they're not really domestic. They're prey animals. They're terrified in the hospital. So she's using ketamine IV induction, which I've definitely used ketamine IV to induce. It can be very effective. Usually I dilute it, as our ketamine comes in 100 milligrams per milliliter, so I usually dilute it 1 to 9 so that it's a 10 mg per mil solution because it's a little bit easier to titrate that way. So I'm not sure if that's what she did, but you can do IV induction with ketamine. It can be very effective if you're using it slowly into effect and you're not just gunning it, because we should never do that with our IV induction agents. So they're maintaining on isoflurane as well as a CRI. I find CRIs are incredibly helpful. We often have like really painful dental patients that will use a lidocaine CRI or a lidocaine ketamine CRI. I've definitely used fentanyl as well in CRIs for exotics, and just because fentanyl has such a short half-life, it's a very effective, very potent pure mu agonist again. And then it can be potentiated by microdoses of ketamine, and lidocaine is a really, really great CRI drug. So they didn't use a lidocaine CRI, but they did do an epidural, which is awesome. So lidocaine bupivacaine, and then post-op this animal got more morphine or buprenorphine. So probably just depending on how painful this patient was. So the buprenorphine does tend to last a little bit longer than morphine. Morphine, I kind of feel like I get a max of 4 hours of pain control with morphine, even though technically it can like last for 6 in rabbits, but I find it doesn't usually last beyond 4. But buprenorphine can definitely last a little bit longer. Although it's a mixed, I think it's a mu antagonist kappa agonist, I feel, because buprenorphine can partially reverse some of your other opioids. And this animal's getting an appropriate dose of meloxicam. One of the biggest pet peeves I have is seeing other hospitals using a dog or cat dose of meloxicam in rabbits. There's been some really good pharmacokinetic data that's shown that those doses are just subtherapeutic. They're not effective for pain control in rabbits. Rabbits really need 0.5 to 1 milligram per kilogram of meloxicam Q12 to Q24. So we'll tend to use kind of like the higher dose, like at least in our practice, we'll use 1 milligram per kilogram Q24 or like a lower dose Q12. And again, they tolerate this really well. They tend to metabolize meloxicam really quickly. So the issue is that if you're giving like a low dose, by the time the animal is at like 18 to 20 hours post-dose, then there's no more meloxicam available, and then we're not preventing our wind-up effect. So perfect. Yeah, and depending on clinical status, because we do try to avoid meloxicam if we have an completely inappetent rabbit, which is a whole bunch of problems. So she's going over some interesting studies as well as just examples of different different opioids you can use. And again, we have so many options in our opioid toolkit, at least in Canada. I know in the States there have been so many problems like with not stability, but availability with opioids. So I really feel for you guys. It's definitely kind of made everybody a little bit more aware of multimodal pain management. I think the last time I did some really good anesthesia CE, I had a VTS in anesthesia analgesia give a bunch of talks at last year's Atlantic Provinces Vet Conference. So Amanda Shelby, who is a wonderful VTS, she was talking a lot about multimodal pain management because there are just drugs that they just can't get, or it's like we have like 2 milliliters of morphine left and then we won't get more for 3 weeks or what have you. So that can be super problematic, so you do have to be a little more creative sometimes with your multimodal analgesia and multimodal anesthetic protocols. So we've got drugs like methadone. I know that I've seen methadone used locally more in the past few years in dogs, cats, and exotics. I feel like it has a reasonably good effect in rabbits. I was using methadone in another practice pretty regularly, and I feel like it went over pretty well. And of course, because morphine and methadone are both pure mu agonists, we do see that both of them work pretty effectively. She does note, of course, we want to avoid IV morphine because of the histamine release, because we don't want that. That can be really hazardous. So if we need like rapid pain management, maybe the methadone is probably better, or, move to a fentanyl CRI. Fentanyl patches are really great. I actually don't think I've ever used a fentanyl patch on a rabbit patient. No, I'm not sure why. I think just because we've always opted for CRIs when they've had something really painful. But patches are great because, as long as they're in a place where the rabbit can't get at it, just like a dog or a cat, it can be a really nice way to provide that pure mu agonist analgesia in a safe way at home, where you're not sending a client home with like needles of an opioid, because that's really sketch. So buprenorphine can work well. I find buprenorphine isn't super great for really severe pain, but like mild to moderate pain often works quite well. We see that it tends to reach a therapeutic level really well. Butorphanol, kind of garbage for pain in mammals in general. It can cause a lot of sedation. So if we have patients where we need to do a procedural sedation, so we're giving them midazolam, but the midazolam alone just doesn't enough to cut it, and they're not super painful, we'll sometimes add on some low-dose butorphanol just to kind of potentiate the midazolam and give us a little more sedation if we have like a really flighty animal. So she's exactly explaining that right here. Non-painful procedure, non-painful animal. So kind of just gives them like sleepiness, but not great for pain control. And that's the same in dogs and cats. We really need to move away from using butorphanol for pain management in these animals. But we can use it in birds, because some birds respond really well to butorphanol, which is really interesting. So, and of course, none of these drugs are licensed for use in rabbits. So we use off-label everything for exotics, it seems. So, and this is great because she's kind of touching on some of the myths that we have with regards to using opioids in rabbits. Hang on, this isn't letting me select it. So what we used to be worried about was using opioids in painful rabbits because we were worried that gut stasis would be worse or would be exacerbated, because technically opioids can slow down gut function. So we often see that at like pre-anesthetic doses, like in our dogs and cats, they can definitely kind of accelerate gut motility. So like those animals that you give them their pre-med and then they have a little diarrhea and then everyone has to clean it up and you're like, oh, okay, it was the pre-med. So what we used to be worried about was using these therapeutic doses of opioids in rabbits and in other hindgut fermenters, because we were so worried that that would inhibit or slow down our gut motility. But it turns out that not treating the pain appropriately is much, much, much worse for gut motility. So don't be afraid to use pure mu agonists in your exotic herbivores, because pain is usually responsible for gut stasis. So again, like full mu agonists, work really, really well to kind of break that pain cycle. And then once the animal stops having that snowball cascading effect, that vicious cycle of being painful, then having a stasis, then the stasis gets worse, so then they're more painful, then we can look at, removing opioids or moving to, non-pure mu agonists. So like buprenorphine we can use. or, hopefully weaning them off onto like just an NSAID, so like just meloxicam or a lidocaine CRI, because lidocaine CRIs are amazing. Like, we should be using these in so many rabbit patients, because not only is it great for pain management, especially for visceral pain, so gut pain, gut or like other, abdominal organ pain, but it's also a promotility agent. So for whatever reason, it works for promotility. It works as a gut prokinetic in rabbits, which is incredible. So she does chat a little bit about gut stasis being caused by stress rather than pain, which I think that when we have these presentations, it's usually just that the client doesn't want to acknowledge that their animal is probably painful. That they say, oh, there was, one stressful event. We had people over this weekend and then the rabbit got sick, so it must just be stress. But realistically, it's probably just that animal is just piling on the stress and pain threshold, because pain does cause stress. And then we just hit that threshold of not being able to hide it anymore because of these cumulative stressors. So the untreated pain and then a stressful event in the home. And then again, once they start to have that stasis, it does snowball into this painful, awful spiral of discomfort. So local analgesia is great. I love local blocks for routine surgeries. Intratesticular blocks are a really easy technique for any of your technicians to do, as well as intradermal blocks for our spays or for like cystotomies. Epidurals are great. Epidurals are something that I need to learn how to do because I'm old and we didn't learn it in school. And I've just never had an opportunity to do an epidural lab, so it's something that I need to learn, which is fantastic. And then there's all kinds of other great blocks, like for TICA procedures or ear canal ablations. There's palpebral blocks, which can work really great. I've seen that technique, and I'm really excited to use it on the next ear patient that I have. Of course, I know ovarian pedicle blocks. Hard to say whether that's achievable in rabbits, but really interesting just to think that we could potentially use it. Common lab animal model for epidurals. Yeah, I think that epidurals are just underutilized in practice in general. And again, epidurals are something that your technicians can definitely be trained to do. It's definitely under our scope of practice in most provinces and most states. So it's something that we can absolutely utilize more of in practice. So CRIs, once again, I love CRIs. I think CRIs are pretty underused in general practice. We use CRIs for painful gut stasis patients, for painful post-op patients, for intra-op, because we want to lower how much isoflurane we're using, because isoflurane, of course, has the most profound physiologic effect of any of these agents that we're using. So just because it's such a profound or powerful vasodilator and can affect our blood pressure, we want to reduce and of course, like at higher doses of isoflurane, you can have respiratory depression. So we want to do everything we can to kind of reduce the amount of isoflurane that we're using. So CRIs are a great way to do that. Plus, we really should have IV access whenever possible in an anesthetic patient, regardless of the species. So, CRI is fantastic. Fentanyl CRI is very, very effective, very easy to titrate. Fentanyl has a very short half-life, and basically any species you use it in, to the best of my knowledge. So you can titrate your pain management really effectively or really precisely. And of course, she's talking about lido CRIs in GI stasis, because again, they are so... Lidocaine is like a wonder drug in rabbits. It's really, really fantastic. It's my favorite thing to throw on a CRI. I'm like, I always have the math like already done. And I'm like, oh, hey doctor, can I just start this lidocaine CRI? Because, I'm really worried that, we're going to have to crank the ISO up a little bit and I don't want to do that. So my doctor's fantastic. And she's like, yes, of course, use the CRI. So they're great. And of course, NSAIDs. NSAIDs are such important pain management tools because they are very effective at reducing inflammation as well as being analgesics. So she is talking about how meloxicam is effectively 8 times the dog dose and typically twice daily. So stop using dog and cat doses of meloxicam in rabbits because it's subtherapeutic and doesn't help. And of course, like, we can go as high as 1 milligram per kilogram every 12 hours in suitable patients. So patients who have a lot of inflammation, who are painful, who may be like a little more opioid intolerant, or we're scaling back on the opioids, but then they're well hydrated. There's no concern of liver or kidney, like, so hepatic or renal compromise. And then patients who are eating a little bit better. So, and she does touch on giving an NSAID prior to surgery, has greater efficacy in dogs, according to a study, as something that I've seen kind of talked about quite a bit in dog and cat anesthesia. But of course, unless we're sure that the animal is going to be normotensive the whole time, which is the goal, but we can't really guarantee it because they don't read the textbooks, they don't know what they're supposed to do under anesthesia, then we would want to avoid it, of course, because if we're having a hypotensive event under anesthesia, then we are a little bit worried that maybe having that NSAID in circulation, if our renal perfusion or hepatic perfusion isn't great, then it might sit there a little bit too long and tentatively cause some toxicity or some insult. So we don't tend to have the same concerns about contact irritation with meloxicam in the guts of these animals, because effectively they should always have food in their gut. So if they're not eating, then we are typically prescribing support feeding so that we can give these NSAIDs at the same time. But the whole reason why we recommend that meloxicam is given with food in dogs and cats is that it's an extremely potent contact irritant to the gastric mucosa. So we don't usually have to worry about that, but of course, telling clients that if you can't do force feedings and, if your animal isn't swallowing, then just don't give them meloxicam. We need to reassess them. And of course, she's talking about adjunctive analgesia, so things like tramadol, which I'd have to look up if there are some PK/PD studies on tramadol in rabbits. I'm not sure if there are. I feel like I haven't seen any, but that doesn't mean they don't exist. And then paracetamol, which is acetophenamine in North America, and I have seen acetophenamine or Tylenol using children's Tylenol, which is now there's a shortage of it locally here, so maybe we won't be using it in our rabbit patients because I feel like people are having to get it compounded for their kids, which is just terrible. But there are pharmacies here that are working really hard to make sure that, parents have access to compounded acetaminophen or Tylenol for their kids. But I have seen Tylenol work really, really well for rabbits in the past with kind of moderately painful conditions. So we want to make sure, again, that they're well hydrated, that they don't have pre-existing liver disease. But paracetamol is great. And I've actually seen it work really well with dog patients as well for post-op pain management, like post-op orthopedic cases or other post-op cases, because we don't want to, lean too heavily on our opioids. Gabapentin is gabapentin's kind of like a wonder drug. And I say that with caution because we shouldn't rely too heavily on just one drug, unless it's lidocaine in rabbits, of course. Gabapentin is pretty effective as an adjunctive pain management drug. So I feel like alone, it's probably not super effective unless the animal has mild pain. I've seen some chronic dental cases where we were able to kind of wean them off of meloxicam and they're just on gabapentin. And then when they get more sore, we're adding the meloxicam back in before we can get them in for a dental management procedure. But we definitely see a pretty good response to gabapentin. Particularly, we have a few rabbit patients that are very reactive when they're coming in for a dental because their mouth hurts so much. So we kind of even considered pre-dosing these animals to give them gabapentin for the week preceding their procedure so that we have much more potent analgesia coming up preoperatively. We reduce the incidence of them having a stasis if they're waiting for a procedure, and it also helps as an anxiolytic. And I feel like there is a study that is happening. I can't remember the name of the doctor who is doing it somewhere in the States, but there is a doctor working on a study looking at gabapentin being used as an anxiolytic for rabbits, which is really important. Of course, NMDA receptor antagonists, so that would be our ketamine, because ketamine actually sort of does work as an analgesic. And I know that was nailed into my head when I was a student, that ketamine is a dissociative anesthetic, it doesn't do anything for pain, but it turns out that if we're using microdoses of ketamine, especially if it's adjunctive, so we're using it in a multimodal plan, it actually can work really, really well for for like adjunctive pain management, which is really cool. I feel like ketamine, there's also a dose published where you can do subcutaneous ketamine in dogs every 3 to 4 weeks for pain, and that seems to work pretty well for some patients. So she's going over some case studies, which is always great. I love case studies. Case studies are great. I hope to be able to do some case studies on these rounds, just as time goes by, because I have a bunch of cases that are like from the archives that I have permission to share, which is great. And this is wonderful that this patient had a thoracotomy to remove a thymoma. Because of course rabbits do have a persistent thymus gland as they grow up. They don't just lose it like a lot of animals do. And thymomas are unfortunately like a not super common, but like a reasonably well represented tumor, intrathoracic tumor. So it's incredible that this client, did that for their rabbit. That's a really big surgery. And again, like this animal going from this terrible grimace, you can see the orbital tightening and the cheek flattening, to having like a much more normal face. That's the grimace scale at work, guys. That's awesome. And then she goes into looking at managing the stress rabbit, because rabbits who are stressed also can have that gut stasis cascade, which is really terrible. So midazolam again works really well as an anti-stressor. So rabbits who their pain kind of should be managed in hospital, but then they're still acting really flighty or they're not eating, we can look at things like adding midazolam, low dose, butorphanol as well. That probably wouldn't be my first choice, again, because I find it's really sedating, and we kind of want them to just be not anxious and, not necessarily sedated in hospital. But then microdoses of dexmedetomidine, which you have to use it in, cardiostable patients. But that's really interesting, because I've actually never used that as an anxiety drug in a rabbit who is an inpatient. I've definitely used midazolam before. I've used dexmedetomidine in dog patients for anxiety, of dogs who are just like screaming overnight in the ICU. That can work really well to do either microdoses, intermittently, or just have them on a very low dose CRI. So that's really interesting for rabbits who are, if they have to be an inpatient and they're super anxious, then, why not? I love having a lot of tools in my drug toolkit. So then we're almost done with pain in rabbits. The third part of this wonderful, wonderful set of articles, again, by Malik, is just looking at management of chronic pain at home. So these are patients who have chronic dental disease, because dental disease is not something we can typically cure. It's something that we have to manage, unfortunately. And osteoarthritis are kind of the biggest ones that I think of. And of course, this is so important. We need to stop saying that patients are kind of just getting old and making that excuse for problems that are treatable, because we really want our senior pets to have kind of the best quality of life when they've given us a lifetime of love, and then they're in their senior years, their golden years. I just went through going through palliative care with my senior dog, and just the thought of not having adequate pain management for my senior dog, who gave me 12 years of love, just broke my heart. So we did a lot for her pain. And it's so important, again, that she's not just getting old. She's not just, having a hard time getting up because she's old. It's because there's pain. So, we should be extending the same courtesy to our exotic patients regardless of the species. So she's going over meloxicam again. Of course, meloxicam is such a mainstay. There is a study for very painful rabbits. We do have a study looking at the safety of a higher dose of meloxicam, so 1.5 milligrams per kilogram once a day for 5 days. Didn't seem to have any adverse effects on blood parameters. So if you have like a very painful orthopedic patient, or post-op orthopedic, or like TICA patient, or any other really dramatically painful procedure, especially if the patient doesn't need to be managed in hospital, or especially if like they're not responding super well to opioids, or opioids just aren't an option for another reason, then going with a higher dose of meloxicam short term in an already stable patient can be really effective. And I have definitely used this high dose for short periods of time and seen like a really good response to it. And of course, we're talking again about higher doses, because if there's one thing to take home from tonight, use appropriate doses of meloxicam for your rabbit patients. Stop using dog and cat doses. And then again, looking at oral adjunctive agents. Oh, okay, great. So we have rabbits produce a metabolite that is effective for pain management from tramadol, but a relatively high dose. That's really disappointing. So 11 milligrams per kilogram did not reach plasma concentrations in rabbits of that M1, so that metabolite of tramadol that is effective for pain management. That's unfortunate. And then this study is saying that they make 5 different metabolites and then it doesn't do anything. So that's unfortunate as well. Reductions in pain parameters such as heart rate, blood glucose, and serum cortisol in lab rabbits given 10 or 20 milligrams injectable tramadol. So interesting. I feel like this is probably talking about oral tramadol, so maybe injectable tramadol is more effective. Basically, this is just saying we need more data on tramadol before we can say, yeah, tramadol is great. Because tramadol is not great in a lot of patients. Tramadol is one of the very few opioids that I can actually take because I respond horribly to opioids, and tramadol works at a very low dose for me pretty effectively for pain. But we're finding that tramadol is just not super effective in a lot of species, which is like dogs. Tramadol doesn't really work in dogs. It doesn't work better than placebo. And there's some really good studies backing that up. So currently reported tramadol doses are like 5 to 10 milligrams per kilogram, Q8 to 12, but it probably doesn't work. So if you do have to resort to tramadol for whatever reason, never use it alone. And then, gabapentin. So again, there's not a lot of research. A lot of the stuff that we know about gabapentin is anecdotal. Unfortunately. So they're talking about gabapentin doses and paracetamol. Again, paracetamol, or acetaminophen or Tylenol, the dose is like kind of scarily high looking. But apparently lower doses can also give you a decent effect. So I guess if you are using paracetamol in a patient that, you're backed into a corner, maybe you don't have any other options, but you're really worried about liver compromise, and you can use a lower dose. And then amantadine, which is really interesting. Amantadine, I've seen that used in a few canine patients, so that's really cool. So she's just saying, there's a suggested canine dose. And then again, another wonderful chart just looking at multimodal chronic pain management. And what's interesting here, she mentions meropitant, so meropitant citrate or Cerenia, because I feel like the company who makes it, so Zoetis, when I've asked the reps, like, what about visceral pain in dogs and cats? And they kind of go like, oh, no, we can't really say anything about that because it's not really proven. But I've seen a lot of specialists, like a lot of internal medicine people, say that meropitant does seem to work pretty well for visceral pain. So it's something that we need more investigation in rabbits for sure. So then buprenorphine isn't a possibility. We don't have a lot of data on chondroprotective agents in arthritic rabbits, so like whether glucosamine chondroitin are super effective. So we need more research into that because we don't know if they're great at metabolizing it or we know what dose is effective. So, and of course, complementary therapies, so things like acupuncture, which acupuncture is so weird because the science is kind of wishy-washy. And if you look up kind of science-based medicine resources, acupuncture just seems like super, super comparable to placebo in humans. But then why does it work in pets? Is this placebo by proxy? We have no idea. So acupuncture is something that we do get a lot of kind of supportive anecdotal evidence, but it should never be something that's used alone because it is adjunctive. And then, of course, rehab techniques. There's not much that we know about rehab in exotics. A lot of it's extrapolated from wildlife, and even then, that's very minor. But like laser therapy and therapeutic massage are becoming much more common modalities to use in dogs and cats as well as exotics. So that's really cool. Laser therapy is really neat. So then hydrotherapy is a possibility, but we have to be extremely careful to mediate stress because rabbits are not great swimmers. Hares, so like rabbits' cousins, other members of Leporidae, the family where rabbits belong to, are really good swimmers, but rabbits can be extremely stressed by being submersed in water, so that's something that we would kind of really cautiously recommend. And yeah, she mentions rabbit fur oils takes a really long time to dry, so I've definitely seen clients who've like tried to bathe their rabbits at home if they have urine scalding, and then it just kind of makes it worse because they have a really hard time drying the undercoat. So can't recommend that. And then environmental modifications, so making sure that like rabbit litter trays, just like we do in cats who have osteoarthritis, make sure that they don't have to jump into a really high litter box, and make sure that they don't have to jump up steps to get places, and that she's suggesting using a snuggle safe to warm part of the sleeping area. I'd be really cautious using anything but a snuggle safe. So those are those pink heat discs that retain heat for something like 8 hours. I wouldn't use like an electric heating pad, because while a cat might ignore that, rabbits like love to chew chew chew, and we don't want to have an electrocution. That would be counterproductive. So she goes over another few case studies. So again, like these are fantastic papers. If you have access to this journal, I would highly recommend looking them up. If you don't, you can just kind of drop me a line somewhere, email me.